Hi guys, Dr. Boris again. I just had an interesting conversation with my new lipedema patient. I think it merits this little conversation about how insurance companies deal with lipedema and how they prevent the hospitals and doctors from performing the surgery. This lady is from Wisconsin, believe it or not, and remember, I'm in New Jersey, half the country away. She has lipedema, has very large legs. I'll show you the picture in a couple of minutes. And it was getting really bad. She was diagnosed with lipedema, stage 4 solid. She found a doctor locally who agreed to do the liposuction for lipedema, and then they went to the hospital, and the hospital said that they don't want to do the surgery because of financial reasons, looking at the codes and looking at the numbers. She fought, and then the hospital agreed, and literally before the surgery, the hospital reneged on it as they looked at expenses and costs of the surgery. That allowed her to make a choice and come to us, New Jersey, where we can equip to do high volume liposuction. But it brings me to the point of how what you need to understand is just because lipedema is covered by the benefits, it does not mean that it's very easy to get the surgery, because both doctors and hospitals are looking at actual costs of doing the surgery and the amount of reimbursement. And if the reimbursement is below what your costs are, then it becomes a money losing proposition, and the hospital and the doctor has to actually put the money in order to perform the surgery. I'll tell you from my experience, when we started this many years ago, one of the insurance companies, not to be named, came in and said their usual and customary fee for this 3-hour surgery is $311. It's a joke. So, and they said, yes, it's covered, but that's what the fee is. And I'm sure the same thing is happening with the hospitals, but when they look at it, the amount of money that the insurance company is willing to pay for the outpatient high volume lipedema surgery is barely the same amount that they pay for the emergency room basic visit. What it's very important for you to know is just because you have a benefit with the insurance company, the benefit may be so low that it's impossible, practically impossible, to perform this surgery, both for the doctor and for the hospital. And that's one of the reasons why a lot of doctors who perform lipedema surgery are not in networks. We would love to be in network as long as we have a fair rate, but we can't get a fair rate. So that's why, unfortunately, we have to stay out of network. And there are very few doctors who were able to secure reasonable rates across the country, and I commend them. We were not successful in doing that, despite having great results, large volume of satisfied patients. But every insurance company has their own rules, and they don't want us, so that's okay. But that's what I'm going to share with you, is whenever you in your journey to get your surgery approved, sometimes you hit the roadblocks that you never expected. Yes, you're covered. Yes, you have a benefit. But then the amount of benefit that the insurance company is allocating for that is so ridiculously low that it becomes practically impossible to do it. And that's the way, legal way, the insurance company are able to limit the services and shift financial responsibility from themselves to the patient. All right. Anyway, this lady was able to fight her fight. She got approval. She got in-network gap exception. We got single case agreement. So both the hospital and us were fine. And looking forward to getting her to feel better.